So my name is Rudy Apodaca, and I work for Dignity Health, Mercy Gilbert Medical Center, and Chandler Regional Hospital. And I am the Vice President of Operations, which means I oversee multiple departments at the hospital. A lot of them are clinical, some of them are non-clinical, and I have the ability to work across all of operations and strategy as well.
What does a typical day look like here at Mercy Gilbert Hospital?
A typical day here is really centered around the patients and their needs. But you have this whole complex of people that help the patients. So we have wonderful doctors and nurses that take care of the patients, but it really takes a village of people to take care of the patients. From the registration people that take them in and get all their information and get them registered, get their insurance processed, security people who come in and make sure the organization is secure for the patients and the staff that work here, pharmacists, laboratory technicians, radiology technicians. We have sleep labs. We have a whole multitude of peoples in the hospitals that take care of the patients and all the various conditions that they come in with. So we have a stroke, primary stroke hospital. We're also a cardiac center here. And so we do a lot of variety of procedures for patients and their conditions here. And then just general medicine. But it really takes a whole lot of different specialties that makes the patient get well and also takes care of their mind, body, and spirit, because we are a very holistic center here.
Other than doctors and nurses, what other occupations are here at the hospital?
So it is an exciting industry to work for. If you think about, if you're good in math and you want to go into finance, well, we have finance people at the hospital. You know, you think of a hospital as only purely medical, but it is a business as well. So if we have people in finance, we have people who are in marketing, we have people who are in strategy, and then we have a multitude of clinical and non-clinical people. Think about how many people we have to feed on an average day. If there's 200 or 300 people in the hospital, how many meals do we have to prepare to serve all those people? So we've got therapists, occupational therapists, physical therapists, speech therapists that help people if they've had a stroke. We've got sleep lab people who keep people from having the sleep disorders. We have radiology people who have very deep scientific backgrounds in being able to do high technical imaging. Laboratory specialists.
So would you say there's really something for everybody in healthcare?
I would say it's like a small town. If you think about it, if you go to a town, there's the people who have to take care of the infrastructure, the lights, the building, keeping the doors on and being able to repair things in the facilities. From every aspect in a small town or a town, it's like you would have in a hospital, because there's every different aspect of having to run this place. It's just like a small plant, a small town. So what I would say is there's always hard work for your foundational education that you do, but there are professions in healthcare that you can take a 2-year course and get a certification in whatever is in healthcare. So you can get a 2-year degree in radiology technology, and it's a very good calling. And the wages and salaries are good in healthcare, and you can make a good living. So you can start from as little as some training to draw blood and phlebotomy to get exposures in healthcare, which is a 12-week course, all the way up to being a pharmacist, a doctorate in pharmacy, which may take you 6 to 8 years.